Hi guys, welcome to my channel. I'm Dr. Babalola by name. This is Herbs Discourse Ask a Doctor. Thanks to everyone that has subscribed to this channel. Thanks for the watch. Thanks for the likes and the comments. I really appreciate that. In my last two videos, I reiterated the importance of routine medical check. This video is going to be a follow-up to that, and in this video I'm going to be explaining and to show you the basics and the importance of those general physical examinations that is being carried out, as well as the investigations that are being highlighted to be carried out during the routine medical check. To those inquisitive minds, they may ask, why are those investigations that are highlighted important than the other ones that are not being highlighted? I am an inquisitive individual. I love to ask questions about things. I love to challenge and to ask questions about certain things that are being said to be known. And I love to get explanation on those. Hence the reason for this video, because I know you are one of them. So if you are one of them, you will love to watch this video from the beginning to the end. So stay tuned and follow me through. In the previous video, if you are yet to watch those videos, I put them in the description below. Kindly watch through the links and then you will understand better this particular video. In the previous video, I highlighted two major components of routine medical check. I highlighted the examination component of it and the investigation component of it. In the examination component of it, I broke them into two, which has to do with the vital signs component and the general physical examination component. I'm going to explain to you the importance of each of the elements of these components. When I talk about elements, I mean what are the importance of checking for the blood pressure? What makes it important in routine medical check? What is the importance of checking body mass index? And what are the importance of the investigations that are meant to be carried out during the routine medical check? So let's proceed. Starting with the examination component. The vital signs component, which has to do with the blood pressure check and the body mass index check. So what make these two elements to be of importance as far as routine medical check is concerned? For the blood pressure check, we always check this during routine medical check because for the blood to circulate through the body organs and system through the vascular channel, it is important that they are to be carried at the normal pressure. If not so, if they are not carried at the normal pressure, it's either the organs are not well perfused or the pressure is too much for them, which can damage them over time. Since blood circulates through all the body system, the need to always check the pressure at which it is being circulated cannot be overemphasized. Hence, the need for the blood pressure to be checked routinely whenever the annual medical check or routine medical check is to be carried out. Because any derailment in this can lead to hypertension or hypotension. The other thing we also check is the body mass index. Body mass index has proven itself to be of more importance than checking the body weight alone, because it incorporates the height. The body mass index is the ratio of your weight to your height in square. So for individual that has that high body weight and is also tall, the fact that the individual is tall, which is increasing in the length of the bones, that alone might have constituted certain percentage to the increase in the body weight. So by the time the body mass index of such individual is calculated, the individual might not be obese or might not even be overweight. So when the body mass index is calculated, the individual can either be underweight, of normal weight, overweight, or obese. The one that is critical to us is when an individual is overweight and also obese. There's what we call morbid obesity. When an individual is obese, it is a risk factor to a lot of medical conditions. As a result of this, the need for us to check the body mass index of an individual cannot be overemphasized. Hence, the need for it to be checked during the routine medical check. What are the other things that are to be done during the examination when routine medical check is being done? We call it general physical examination. General physical examination entails examination of the whole body from the head to the toes. And how is it being carried out? The examiner, the medical doctor, is going to stay at the right side of the patient where the patient is lying on the couch. When the patient is lying on the couch with the body exposed and the critical areas being covered, the examination is going to start by examining the texture and the nature of the hair. It moves to examining the eyes for any discoloration, any yellowness, redness, or bluish discoloration of the eyes. The ears are going to be checked. The mouth is going to be checked. The nose are going to be checked. The neck is going to be checked. The chest is going to be checked. You will agree with me, the chest houses two major organs, the lungs and the heart. This is going to be examined and they are going to be checked and be auscultated by stethoscope to listen to the heart sound and to listen to the ear and the sound of the ear that is entering the lungs, and also the heart rate and also the respiratory rate. The abdomen is going to be checked for the stomach and the intestine. The urinogenital system is going to be checked, and also digital rectal examination is going to be carried out in males to be able to examine the prostate, the location, the size, and the texture of the prostate cervix. So the other thing that is going to be checked during general physical examination is the musculoskeletal system, whereby the hands are going to be checked, the armpit will be checked, and the feet will be checked. While checking for the hands, the nails are going to be checked to look at the nature of the nails, the angulation, because they give us signs to a lot of medical conditions. The feet are going to be checked for any form of swelling or any form of abnormality which could be pointer to a lot of medical conditions. So these are the things that are meant to be checked during the general physical examinations, and I've highlighted to you how important these components and these elements are to total well-being. This is the reason why this has to be checked during routine medical check, so that an individual can be certified to be medically fit or not. So the next thing to be checked during routine medical check are the investigations. For the investigations, if you are yet to watch the previous videos, I will put the link in the description below. Kindly click on them and watch them. They are short videos and they are going to show you the list of the investigations that are expected to be carried out. However, I told you that the reason for this video is to let you know the essence and the reason why those investigations are being carried out. What made them to be important than those ones that are not being carried out. So the list of those investigations include the random blood sugar or the fasting blood sugar. The random blood sugar and the fasting blood sugar is the same. However, what differentiates them is the period of the day and the interval at which they are being carried out. For education purpose, I will state this. Random blood sugar is the blood sugar check that is being done after an individual had eaten and in the course of the day, just randomly. But fasting blood sugar is the one that is carried out having told the person to have fasted a night before from 10 p.m. and the blood sugar level is being checked as early as possible before 8 a.m. the following day. So the individual had fasted, and then the level of the sugar in the blood can be controlled, and the result will be viewed in reference to the range that is expected to be viewed with. There is a different range for random blood sugar, there is a different range for fasting blood sugar. But of all this range, what is meant to be noted is that we have normal range and abnormal range for each of them. So regardless of when the blood sugar level is being checked, once it is being viewed in reference to the range that is expected, once it falls within the normal range, definitely it is normal. Once it falls within the abnormal range, definitely it is abnormal, and then there will be need for further evaluation. Because of how important the blood sugar level is to know if an individual is diabetic or not, hence the need for this to be checked, because we know how prevalent diabetes is in the society. So due to this, the need to check the blood sugar level is quite important during medical check. The other investigation we also check during medical check is the full blood count or total blood count. The full blood count will give you a range of results that show you the level of the hemoglobin concentration, the platelet count, and the white blood cell count. The hemoglobin concentration will show us if the blood cell level of the individual is normal or not, which will be a pointer to if the individual is having anemia, low blood level or not, or if the individual has an ongoing infection, which will be shown by the level of the white blood cell count. The platelet count will let us know if there is derangement in the blood clotting mechanism of the individual or not. So because of this, the result that we are going to get by checking the full blood count, it is of essence, because knowing the status of those things I've mentioned is critical to total well-being of an individual. The other investigation we also check is the urine analysis, which we usually call urinalysis. Urinalysis helps us to know two major things: to know the functionality of the kidney, which includes the excretory function, if the kidney is excreting the waste product well or not, and to also know if there is an ongoing infection within the kidney which can affect the whole body. Hence the need for this investigation to be carried out during the routine medical check. The other investigation to be carried out during the routine medical check is the kidney function test itself, which is usually known as electrolytes, urea, and creatinine. Kidney performs several functions, of which excretory function is one of them, and hormonal function is one of them, and also the electrolyte balance function is one of them. If kidney is deranged in its functions, definitely the electrolyte balance of the body will be deranged, which will affect the functions of the cell of all the body organs and the body in general. So the need for us to know the electrolyte level, which is the functionality of the kidney, is quite essential. The urea level, which is meant to be excreted, and also the creatinine level, which is meant to be excreted, is essential. If they are high, definitely shows that the kidney is not excreting them well. Definitely is a pointer to the fact that there is an abnormality that is going on, or there is an infection or a disease condition that has to do with the kidney that is ongoing. Hence the need for this to be checked routinely during the medical check. Liver function test is another investigation to be carried out. You know how important the liver is to protein production, and also the secretory function it also does, and also the detoxification of toxins in the body. So the need to carry out the liver function test to know if the liver is functioning well or not is very important. Hence the need for it to be carried out during the routine medical check. The other investigation to be carried out during the routine medical check is the fasting lipid profile. When you check your lipid profile, it helps you to know if the cholesterol level in the body is too high or is too low. The reason why we need to check the cholesterol level is because if the cholesterol level in the blood is high, it can lead to its deposit on the blood vessel. When it leads to deposit of the cholesterol on the blood vessel, it can lead to what we call hypertension, or even increase the risk of an individual coming down with diabetes. Hence the need for us to check the cholesterol level of an individual, which is the lipid profile. The other investigation to be carried out in an individual is ECG, electrocardiogram. ECG helps to know the electrical function or activity of the heart. If the electrical activity of the heart is not functioning well, definitely the pumping function of the heart will be deranged, will be compromised. if the pumping function of the heart is compromised, definitely the entire perfusion and circulation of the blood through the body will be compromised. Hence the need for us to check the ECG, the electrocardiogram, during the routine medical check. The other investigation we carry out during the routine medical check is the chest X-ray. I stated earlier on that the chest houses two major organs, the heart on the left, the lungs on both sides. What chest X-ray does for us, it allows us to view the heart and the chambers, to know the position of the heart, if the heart is enlarged in general, or any of the chambers of the heart is thicker than expected. The thickness of the chambers of the heart is essential to its functionality, and it tells of certain complications that is occurring in the heart or not. So while for the lungs, it helps us to view the lung to see if the air is perfusing the lungs very well, or if there is any lump or any mass that is growing within the lungs. Hence the need to carry out this particular investigation, because the lungs and the heart are essential to total well-being or health of an individual because of the function they perform as far as the health is concerned. So having stated these general investigations, the other investigations that are essential as far as gender is concerned are these. For males, the prostate specific antigen PSA is a blood test that is being carried out in male. It's essential because it tells us the functionality of the prostate. The other investigation to be carried out in male is prostate scan. I stated earlier on during the general physical examination that digital rectal examination is going to be done in male to examine the prostate, the position, the texture of the surface of the prostate and its relationship to other structure. However, there are some things that will not be seen during this digital rectal examination, can only be seen when prostate scan is being carried out. Prostate scan will allow us to view the position very well of the prostate and the other structures surrounding it, like the bladder in front of it, the rectum at the back, and also allow us to look at the size of the prostate and to measure the size of the prostate, if it is enlarged or not. Because of how important the prostate is and the prevalence of prostate cancer in male at certain age group, it is essential that this is included in the routine medical check of all male. The other investigation to be carried out in females specifically is the breast scan. Breast scan allows us to check for those breast lumps that cannot be seen by physical examination. You know the prevalence of breast cancer all over the world in the recent time, hence the need for this investigation to be carried out. The other investigation to be carried out is the cervical screening, the pap smear. You know the prevalence of cervical cancer, the cervix, which is the outlet of the womb that is connecting the womb to the vagina. Cervix is quite essential that we carry out certain screening on it because of the prevalence of the cervical cancer in women. As a result of this, the need to do pap smear as part of the routine medical check during the routine medical check is very, very important. So these are the investigations, and these are the reason why these investigations are selected and are important to be carried out during routine medical check, because give detail as far as the general well-being of an individual is. Not as if the other investigations are not important, but these are core investigations that are meant to be carried out, and these are core general examinations that are meant to be carried out in an individual during the routine medical check. I am sure you are no longer in doubt of why these investigations are important and why this general examination is important. If you are yet to do your routine medical check, kindly proceed and do that. It is essential you do that at least once a year. If you don't have any complaint at all, and then if you have complaint, it can even be done more than once a year. If you are yet to subscribe to this channel, kindly click the subscribe button, share this video for those that it will be of benefit to, and let me hear your feedback through the comment section. Like this video as well. See you in the next video. Really appreciate. Bye for now.